White line disease encompasses a range of lesions that typically occur in the abaxial white line region towards the heel or outside claw of the rear foot. On most farms, it is one of the three most common causes of lesions and lameness in dairy cattle. White line lesions range from hemorrhages to separations and abscesses. Lame cows typically present with areas of white line separation that are painful when tested with hoof testers, or areas of more extensive hoof wall separation that can extend up to the coronary band. The exact nature of the cause of white line lesions is unclear. What is known is that the white line is made up of three different types of horn, and white line horn is weaker than the wall or sole horn. Current thinking on the pathogenesis involves similar theories as described for sole ulcer pathogenesis, where the P3 suspensory mechanism is compromised, and this results in damage to the keratinocytes that grow white line horn. The presence of both shearing forces and weaker horn at the white line allows the formation of fissures. These fissures can allow the entry of bacteria and foreign bodies, resulting in damage to the corium and inflammatory changes to P3. Prevention of white line lesions starts with avoiding excessive trauma to the white line region by ensuring both cow walking surfaces and cattle handling allows the cow to walk at their own pace and not slip. An additional prevention strategy is to incorporate the use of supplemental minerals and biotin to increase horn strength. Finally, the strategic use of an appropriately timed and correctly performed hoof trimming is a key component of any prevention program. White line disease can appear as an acute and painful condition. However, there are gradients of white line lesions, and appropriate early treatment is critical to successful resolution. The treatment of painful white line lesions involves the removal of all loose horn around the lesion, including the wall. This removal should occur delicately, with great care taken to minimize further damage to the corium. Once loose horn has been removed around the lesion, pressure on the lesion should be reduced to maximize the speed of horn growth. The reduction of pressure on the lesion is achieved by the removal of horn around the lesion and by application of a properly sized hoof block to transfer weight to the sound claw. Cows with white line disease should be rechecked in 3 to 6 weeks to assess healing and to either remove or reposition the block if necessary. Although currently not available in the U.S., the use of an NSAID in white line lesions should be considered to counteract the inflammatory changes.